The production of this program is made possible thanks to the support of the following and viewers like you. The BC government just launched a pilot program called Track and Trace, a 2-year initiative led by Aidos Innovations, a non-profit translational science institute developed at the University of British Columbia with support from law enforcement. This new initiative will analyze the unique chemical fingerprint of illicit drugs, says Victoria Police Chief Fiona Wilson. Key to the success of the pilot program is Vancouver-based Redwood AI, whose technology turns raw chemical testing into usable intelligence for police, border officials, and health agencies trying to keep pace with a drug supply that changes from week to week. Drug dealers do not publish the composition of the products they produce, but we at Redwood AI can back-calculate the method of production, says Louis Dron, one of the founders of the Vancouver-based artificial intelligence company. Using our proprietary software and analytic solutions synthesis tests, we analyze more than 1 billion molecules and reactions and identify manufacturing pathways in seconds, says Dron. The platform the company created predicts and optimizes synthesis pathways across drug discovery and development, which enables law enforcement agencies to zero in on drug precursors, their source, and supply chain. I invited Louis Dron, the CEO of Redwood AI, to join me for a conversation that matters about the convergence of advanced chemistry, AI, and addressing the missing link in the drug crisis in Canada. This is pretty exciting news.
It's a fantastic start. It's been an exciting month since we last had our conversation that mattered before.
Well, I find it so interesting to be able to say, okay, here is a Vancouver-based AI company, and we're still in nascent days when it comes to AI. You're saying we're taking our technology and we're going to put it to practical use in addressing one of the biggest issues that we have, the drug crisis in British Columbia. And if it's successful here, who knows how that will spin out. Let's first of all talk about how did the project come together, and then what are the unique elements of it. So where was the genesis of this idea?
So this idea actually started quite a while back with some of the research being done at Vancouver General Hospital, at the University of British Columbia, even sort of preceding Redwood AI as an entity, as a corporation. There were a lot of folks working both in the health sector, the technology sector, and of course in the police force, concerned about the information that they have associated with the opioid crisis. And of course, there's not one singular solution to this particularly challenging topic, but there are a lot of technologies that might be able to support, to augment, to be used as a tool associated with this crisis. We got involved in the early stage discussions of this maybe half a year ago or more, starting to talk through how the technology that we'd developed could possibly fit into what was being proposed then as track and trace. As you can imagine, there are a lot of different institutional partners involved in this. We have the University of British Columbia, a whole host of police forces, we have government agencies, and of course Aidos Innovations sort of, as the key nexus between all these other pieces for which Redwood is supporting with the AI technology side. We've also been working in this space for a while. So actually during the COVID-19 pandemic, our team, as part of another organization, had developed dashboards and information areas to share information on clinical trials, let's say during the COVID pandemic, putting together all these sources. It was one of the top cited papers in the Lancet Digital Health. And so we sort of saw an interesting convergence here between a couple of the technology projects we've done before. We need to know a little bit more about what's going on in terms of the routes through which these illicit drugs are trafficked through British Columbia. We need to know how they're made, and we also need to have a way to display this that can actually be useful for, say, law enforcement for health purposes.
The production of this program is made possible thanks to the support of the following and viewers like you. So did it start out, first of all, with a challenge saying, well, I'm not entirely sure what I'm dealing with here with this patient? Because they're showing up, they're presenting with a wide variety of different responses to a drug, but I can't identify exactly what it is. And unless I know what that is, then what's my next step?
Yeah, so I'm not a physician myself, but repeating what I've heard from some of the folks, such as Dr. Puya Azar, who's part of Vancouver General Hospital, that's exactly what spurred a lot of this on. They have an expert team there that works on protocols that are internationally recognized as being, first in their field in response to some of the changes we see in, sometimes people call it, say, the toxidrome, the combination of drugs that a patient may be taking here as well. And in particular, we heard from the BC government at the remarks last Friday, some of these drugs can actually completely change how you manage a patient. So medetomidine is an additive added to the supply, which has come up in recent, I'm not sure the exact time period, maybe half a year or so, which can actually suppress the response of Narcan, of the rescue medication here as well. Now that's an enormous challenge. If you're
and how would you know that unless you could analyze what was in the system of that person at the time?
Exactly, and so there are ways in which this is analyzed in hospital laboratories and elsewhere, but really sort of having an early warning system was what was of key interest here as well. So we can be sort of, reactive and able to respond to the new data seen in front of us. But if we're not able to see trends, and we know from historical experience that what happens here in Vancouver may be something that we also see in Victoria. It might even be something we see in Fort St. John across the country going a little bit further afield. But there are networks and patterns that we see over time.
And that's because whoever the composer of that chemical substance may have a distribution network that is considerably wide and fairly consistent. So the challenge then, I'm sure, has been, before you came along, now we're seeing a different reaction. What happened?
Yeah.
Are you able to then be able to say, oh yes, well now this is what the chemical composition is and how it's changed and what the response will be?
Yeah, so there's a few different partner groups that come into this project, and maybe I can talk through some of the flow and how the proposal is set up so far. So at the University of British Columbia, they have this fantastic analytical service, and this is a team using advanced robotics actually, looking at a very, very, very fine level of detail what chemical matter is in the sample that's been taken from a no-case seizure. So this is the police will, for example, in a case in which they're not litigating against, take samples from, say, drug busts and other sources. Now, most conventional drug testing will tell you, for example, this has fentanyl in it, this has, cocaine in it, this has, whichever other samples. But when you look at a really granular level of detail, what you actually see is there are trace impurities in the process. There are small amounts of, sometimes these might be additives, let's say, but there might also be small amounts of the chemicals used to produce the illicit drugs in the first place. And what the anticipation is that these are like chemical fingerprints. That's what a lot of the language around here is like, okay, yes, there is fentanyl, but there is, I'm making up the additives here, for example, a trace amount of gypsum, so used in drywall. There's a trace amount of maybe a solvent that might give you an idea about a precursor. And there are a following set of trace amounts. Now, the challenge for law enforcement and also for medical professionals quite often is if they receive a sample, okay, that has fentanyl in it. But everything else, they might not be able to see at the moment, and they certainly can't see it in real time. The lag phase is a real big challenge here. We've heard from our partners. I need to know the information as it's happening and as it's evolving. And things can change dramatically here in weeks and months. And we've seen that in BC several times to terrible effect historically. So there's an analysis phase. We need to know what's in these samples at the sort of chemical fingerprint level. We then need to sort of predict, well, where will this be next? Where are the trends? Where are the patterns of this being distributed? This is very important for law enforcement purposes, but also for health purposes. If every single time I see a new chemical fingerprint turn up, it appears in this postcode, it moves to this postcode. Now I can start thinking about early warning systems in the next postcode that it's going to turn up in there as well. And predicting how that's going to happen is a big part of what we're doing at Redwood AI as support of this project. We need to integrate a lot of different data. We're dealing with chemical data here too. These chemical fingerprints can be very complicated. We're dealing with time and space, which sounds a bit metaphysical, but really just in the maths and the way we AI model this, where are we likely to see these distributions next based off of what's before? What are the links we can make between these? And then on top of all of that, we need to make sure that it's usable by the folks actually engaging in this process. We talked a bit about this before with AI. It's a fantastic tool, but it is a tool, and therefore it needs to be developed and co-developed with those who are going to be using it. So we're working very, very closely with folks from health, with folks from policing, to work out what do you want to see day to day. It's exciting to talk about AI and the predictive piece of this too, but at the heart of it is even just organizing this data spreading it across jurisdictions, and finding out a way to share information.
The production of this program is made possible thanks to the support of the following and viewers like you. So the reason that I started on wanting to address the health side of this is because that makes sense to me.
Yeah.
You go, okay, you're presented with this information, you can develop a practical response. But what intrigues me the most is how this will aid law enforcement, border officials, and anybody else that's in that whole law enforcement community.
Yeah.
So how does this help them identify what the supply chain might be, and ultimately, hopefully, lead to identifying who the producers and the distributors are?
Yeah, so there's a few different pieces to it, and I think that the health and policing angle is really interesting, and we saw it on Friday. You have two ministers from two separate divisions coming together for a common purpose, and that shows the seriousness of this crisis and how it interacts with many different areas of first responders here as well. What we're anticipating to see here is these unique fingerprints are potentially associated with specific distribution networks. So say, for example, a particular, we'll call it a chemotype. So here I'm referring to that unique combination of the illicit drugs, but also some of the byproducts. They might be associated with different distribution strategies. So they might go in certain areas that don't overlap with other areas. So you could imagine, for example, two distributors might not agree on selling in the same area or space potentially here as well. So the expectation is that as we develop this chemical library of data, as we develop a better understanding of these models and the distribution patterns, that might provide them information used for disruption activities, able to disrupt the supply of illicit drugs in certain areas. It might provide them some information as part of their other investigations associated with where are these being produced. If you're seeing significant amounts of potential precursors, that might give you some leads to start looking into areas for which they know are getting a lot of these precursor materials there as well. So there's a few different angles for it. I think part of it is even just having high quality, readily available, up-to-date information about what is the current status as of today, as of last week, what's happening to the distribution patterns. From the folks we spoke to on the law enforcement side, that's a really big challenge at the moment, because you need to integrate a lot of cooperation between many different agencies, different groups. You need officers to be able to report into the system. And it's a lot of work associated with identifying what those patterns are. So potentially for disruption activities, potentially for a better understanding of what's happening, where the trends are occurring, and potentially for between agency cooperation as well.
I can't help but think that these illicit drugs are not being produced in clean rooms.
So, I'm not an expert chemist on this, and of course we won't discuss in too much detail the chemical composition, but that's absolutely the case. So thinking about our last conversation in pharmaceutical drug development, there's an enormous accreditation process associated with production of pharmaceuticals, whether you're making new pharmaceuticals or even say something like paracetamol or an over-the-counter medication. To get GMP certification, good manufacturing practice certification, is an enormous amount of paperwork, inspections, proof that to a 99.999% level you have purities there too. It is not the same case for individuals not subject to that sort of regulation, which is the challenge.
So when a drug is produced in a clean room, you're getting pure chemicals that you're analyzing. When it's not in a clean room, there's other environmental elements that will infiltrate that drug sample. Are you able to identify those as well?
So this would be part of what the pilot aims to investigate here too. We know the technology from the chemistry side is able to detect incredibly low concentrations of chemicals, and the technology being used through the two sort of analytical types are very well understood with respect to human health and biology, and they're used very frequently in these spaces. They haven't been applied as frequently to these illicit drug samples. So in truth, there's some expectation about what we might see and the reality of what we might see as well. But absolutely, to get to the level of purity, say, for a pharmaceutical medication, we're aware of the sort of machinery required for this too. That is something that would be highly unexpected to be for illicit drug development.
So the I want to be a detective side of me goes, okay, if you can pick up trace environmental elements,
Yeah.
would you also be able to pick up trace DNA samples?
That's
Am I asking you to push right out beyond the edge? But I mean,
Yeah.
imagine what is the potential.
Yeah, so it's interesting. So at the moment, the project is not aimed at sort of individual prosecutions or identifying individuals associated with this. This is about, general trends of no-case seizures. I wouldn't be able to comment, unfortunately, on whether DNA fingerprinting might be.
That's because it's still in development, and you have to be quiet about it.
But this is the thing, evaluating new technologies in a new field with a whole host of different agencies, and the background of everyone here is incredibly diverse with respect to what they know. We're still coming up to speed in many ways with respect to understanding how do things work operationally. Our space has historically been pharmaceuticals. The world experienced by, say, detectives at these various agencies is an entirely different framework to what we're used to as well. But they have such a wealth of knowledge. Even on the chemistry side, we're still being informed of, certain trends in elements to be looking up for here too. So, yeah, the DNA fingerprinting, I'm not sure. It could be an interesting parallel. We'd have to refer that to our partner organizations to comment on. But from the chemistry side, certainly it's that unique fingerprint there too. And we'll see that differences between samples.
So where are we at in this test program right now? Have you already started sampling and being able to deliver results?
So the program has just been formally announced as of Friday. And so there's been background work done in preparation for that announcement. So for example, the setting up of the analyzers for which were shown on the tour last Friday. We've been working in the background on some coding pieces here and too, thinking through some sort of dashboard visualizations and talking through with our partner organizations. It's a 2-year pilot program, so there are a few stages associated with this. And really at the early stages, it's troubleshooting some of those challenges. So some of these are even things that might not be obvious to the viewers. So for example, illicit drug samples come in many different formats and forms, chalky powders, thick, gloopy sort of syrup type compounds here as well. Part of the team that's working on the chemistry side at UBC needs to set up a robot that can handle all of those. Now, as a chemist, you can sort of figure out the right way to work around these compounds. But as a robot, you need to be able to program it to deal with lots of different sort of solution types there as well. So that work has been done on other samples historically, and the team has run through those pieces. And we're starting up those discussions over the coming weeks with the police member agencies, for example, about data sharing agreements, how can we get this built into the dashboard, and a few other pieces. So whilst there is a lot of work and historical effort that's gone into getting it to this point, there is still 2 years worth of runway ahead of us where there are so many challenges associated with it.
The production of this program is made possible thanks to the support of the following and viewers like you. You've referred to dashboard a couple of times.
Yeah.
What does that mean?
Yeah, absolutely. So the goal of this, so we talked a bit about the chemistry here, right? So we're sampling and we're comfortable with the idea that there are sort of, chemotypes, chemical fingerprints associated with various illicit drugs. But really key to that being usable information is a way to visualize it, to actually see what's happening. So the intention is for us to create a dashboard. The dashboard is what's partly supported by AI that we'll talk about in a minute for the predictive features. But even just having these visualizations, and there are parallels, again, at its early stages here, being drawn to what we would see in the COVID maps. I don't know if anyone watching would have seen this, but this is, these maps showing where are there hotspots of activity, what sort of, for COVID-19, it was the variants, if you remember. So this was, different slight variations on there too. There could be a very strong parallel to what we're doing here. The fingerprints could be thought of as variants in this case, and we see distribution patterns changing over time. So the dashboard is a way to sort of take a lot of, complex chemical data and put it into a visualization that is being co-developed with the policing agencies for their officers and agents to be able to identify where are we seeing patterns here as well. This is unique new data, and it needs to be shared across a number of different jurisdictions and groups. So the idea is an all-in-one spot where you can look at the data and draw your own conclusions. As we know, law enforcement has a fantastic group of very, very talented individuals whose whole career is identifying patterns. You were talking about playing detective. This is exactly what they're doing. They're using data from so many different sources, and we hope that this is another valuable source of data for them to have. And that's without the AI predictive layer. So this is just purely let us put up on a page in a nice, accessible, frequently updated manner what's happening. What can I see happening elsewhere? Where can I see it here too? Then there's the potential for an AI layer, which says in 2 weeks' time, this is the areas in which we think we're going to be seeing more activity associated with that particular chemotype.
And that's because AI has the ability to analyze in much greater volume the trends that led to now.
Exactly. And so this is why this is another great use case for AI, because we're dealing with what will be ordered data. So this is, the chemical fingerprint is very complex, but it's ordered and it is always in the same sort of structure here too. The intention will be for the no case seizures. So again, these samples taken not associated with legal activity or litigation. Roughly where they were taken from and at what time. And that gives you, actually quite a complicated interaction here that we would have to deal with as individuals. I'm dealing with individual chemotypes. I'm dealing with, trends in time. I need to look back at lots of historical data potentially here as this starts to fill out. And I need to see what have the changes been recently. As we've mentioned a few times, these trends change very suddenly, right? So having,
with nobody advertising the change.
Nobody advertises the change, unfortunately. And so, if you had historical data going back 6 months, how relevant is that to what's happening now? In some cases, maybe highly relevant. Maybe there's very repeat activities that you can predict, but maybe there are new trends which you're going to need to have some support in seeing early on. So the idea of the AI is as a supportive tool here too. This is not to supersede anyone's investigations or anything else. This is just a flag. This is an unusual pattern of activity, and here's where we think that it's happening next in the future. And so we're trying to integrate all of this, chemistry data, law enforcement data, and we're working with these agencies to see how much we can bring in and how we can sort of predict that, again, under their very, very strict data sharing agreements and governance structures. What's the best way we can predict what's going to happen next, and how can we keep this up to date?
So as far as this program is concerned, you're still not quite at the beginning because you have processes that work and you can start to integrate them and see. When do we move into the stage where you go, okay, we are now delivering the kind of data that's making a difference?
We're hoping to have this available, the dashboard, within the next half year. So this is a very short period of time for such a big program. So this is the intention to get it into individuals' hands. And the way that we've always seen these AI technologies and technologies in general work historically is you need to give it to people early on and ask them to break it, basically. And that's the best way to develop these. So we'll be working with our law enforcement partners, with our health partners. What do you need to see next? What are you not liking right now? The big challenge we see sometimes in AI and new technologies is, a product gets dunked in front of a team after 2 years of development, and then they walk away and they say, here you go, enjoy this very much. That creates all sorts of challenges. People don't have ownership over what they're seeing. They would like small modifications that at that point are really hard to integrate. After you've done all, to be a bit coding nerdy here for a moment, it can be a real challenge for structural changes at the late stage in the program. So really the key for the next half year, get it in individuals' hands, get these people who are actually going to be using this to have their say in how this is developed there as well. They might not have their say about specific, sub-parameters of AI models, but even just this core piece, key to all of this is sharing this data in a way that's entirely usable for two, distinct but related audiences in health and in the policing side.
The key being collaboration.
100%. And that's where AI is at its strongest, in our opinion, here too. And we've seen it with our work in the pharmaceutical space. We believe it absolutely applies here too. This is such a complex topic. There's been so many individuals around the world, and particularly here in Vancouver as a hotspot of this activity, trying to find innovative ways to solve this incredibly challenging problem. And of course, it sounds like an obvious point, but it's really worth emphasizing it's a collaborative activity here too. So the AI is a tool. It can support those with the expertise, but we need to develop it in collaboration.
This is the kind of AI development that we want to see. So there's some people who are all worried about AI, but this is the kind of advancement that produces better outcomes and a better world that we can live in.
Absolutely. And so, this is supporting, freeing up resources, drawing attention. It's not replacing people's roles and experiences, right? This is in the same way that we now have tools and technology that make our life easier in many other aspects of our life. The intention for AI here is to play a supportive role. This is information that's, passed through a very complex system that deals with the challenge that we don't happen to have, a whole host of data scientists, chemists, law enforcement, medical doctors, all at the same time. We have those individual components and we're trying to synthesize all that together.
Well, thanks for giving us a glimpse into this. It's an exciting program. And hopefully we'll have you back in a while where you can give us an update on how it's going.
We'll have a live demo going in the background. I'll have to check in whether we can share that data. Absolutely.
Wonderful. Thank you.
Thank you very much.